The screech of tires echoed across Interstate 40 just before dawn. Metal twisted. Glass shattered. A semi-truck had jackknifed across 3 lanes, crushing a sedan beneath its massive weight. Steam hissed from broken engines. Someone screamed for help. Dr. Sarah Chen had been driving home after a brutal overnight shift at County Memorial Hospital. She was only 28 years old, fresh out of residency, still proving herself every single day. When she saw the crash ahead, her hands tightened on the steering wheel. She pulled over without thinking twice. She grabbed her medical bag from the trunk, she always kept one ready, and ran toward the wreckage. Morning mist hung low over the highway. Other cars had stopped. People stood frozen, filming with their phones, too shocked to move. "Call 911. Sarah shouted, dropping to her knees beside the crushed sedan. A man was trapped inside, pinned behind the wheel. His face was gray. Blood soaked through his shirt. His breathing came in wet, shallow gasps. "Sir, can you hear me?" Sarah pressed her fingers to his neck. His pulse was faint, irregular. She leaned closer, scanning for injuries. A piece of metal had pierced his left side. Blood pooled beneath him, too much blood. A truck driver ran up behind her. "Ambulance is 10 minutes out." 10 minutes. Sarah knew he didn't have 10 minutes. She tore open her medical bag, pulling out gauze and gloves. She spoke calmly to the injured man. "Stay with me. I'm a doctor. You're going to be okay." His eyes fluttered. His lips moved, but no sound came out. Sarah worked fast, applying pressure to the wound, trying to slow the bleeding. But something felt wrong. The blood wasn't just coming from the visible puncture wound. There was too much of it, spreading too fast. Internal bleeding. Maybe a ruptured spleen. Or worse, a torn aorta. She checked his abdomen. It was swelling, rigid. His blood pressure was dropping. Classic signs of hemorrhagic shock. "Stay with me," she said again, louder this time. Finally, sirens wailed in the distance. Flashing lights appeared through the mist. 2 ambulances screeched to a stop. Paramedics jumped out, hauling equipment. Behind them came the fire department with heavy rescue tools. An older paramedic jogged over, a thick man with gray hair and a weathered face. His badge read, Captain Monroe. He glanced at Sarah, then at the patient. "Step back, miss," he said. "We've got this." "I'm a doctor," Sarah replied, still pressing gauze against the wound. "He's in hemorrhagic shock. Internal bleeding. He needs a hospital now, but you need to stabilize." "We know what we're doing," Monroe interrupted. He turned to his team. "Let's get him out. Careful with the extraction." The firefighters moved in with hydraulic cutters, slicing through the crushed metal. It was loud, chaotic. Sarah tried to stay close, but Monroe waved her off. "Please. Let the men handle it. You'll just be in the way." Sarah felt heat rise in her chest. She wanted to argue, to push back, but the paramedics were already surrounding the patient. She stepped aside, hands still bloody, watching helplessly. They pulled the man free from the wreckage and loaded him onto a stretcher. Monroe barked orders. Another paramedic started in full line. They checked his vitals, applied oxygen, wrapped the visible wound. But Sarah could see it in their movements, they were treating the surface injuries. They weren't addressing the real problem brewing inside his abdomen. "He needs fluids, fast," Sarah called out. "And you need to compress his abdomen during transport or he'll bleed out before." "We've been doing this for 20 years, Monroe snapped, not even looking at her. "We don't need some rookie telling us our job." The other paramedics ignored her completely. They lifted the stretcher into the ambulance. Doors slammed shut. Sarah stood on the highway, covered in a stranger's blood, watching the ambulance speed away. Her heart pounded. She knew, they were missing something critical. She ran to her car, started the engine, and followed the ambulance toward County Memorial. The same hospital where she worked. The same emergency room where nobody took her seriously. She had to try. The ambulance bay doors flew open. The stretcher rushed through, wheels rattling against tile. Sarah parked and sprinted inside just seconds behind them. The emergency room smelled like disinfectant and stale coffee. Fluorescent lights buzzed overhead. Nurses moved quickly, voices sharp and urgent. Dr. Raymond Gallagher stood waiting, arms crossed over his white coat. He was 62, a veteran trauma surgeon, respected and feared in equal measure. His gray eyes swept over the patient, then landed on Sarah. "Dr. Chen," he said coolly. "You off shift? What are you doing here?" "I was at the scene," Sarah said, breathless. "This patient has massive internal bleeding. Likely abdominal. His pressure's dropping fast. We need to get him to surgery." "We'll assess him ourselves," Dr. Gallagher interrupted. He turned to the trauma team. "Get a chest X-ray and start 2 large bore 4s. Run fluids wide open. Let's stabilize him first." Sarah stepped closer. "There's no time to stabilize. He's bleeding into his abdomen. Every minute we wait." "Dr. Chen." Gallagher's voice turned ice cold. "You've been a physician for what, 5 months? I've been doing this since before you were born. Step back and let the experienced doctors work." The words stung, but Sarah swallowed her pride. She moved to the side of the trauma bay, watching as the team worked. They hooked up monitors. The patient's heart rate climbed, fast, desperate. His blood pressure continued to drop. A nurse called out the numbers. BP 70/40. Heart rate 130. Sarah's stomach twisted. She glanced at the monitor. His abdomen was visibly distended now, tight as a drum. "He needs an ultrasound," Sarah said quietly. "Just a quick fast exam. It'll show the bleeding." Dr. Gallagher didn't respond. He was listening to the patient's lungs with a stethoscope, frowning. "Breath sounds are diminished on the left. Probably a pneumothorax. Get me a chest tube kit." Sarah's eyes widened. "That's not the priority." "Enough," Gallagher snapped. "If you can't be helpful, leave my trauma bay." The room went silent. Nurses exchanged uncomfortable glances. Sarah felt humiliation burn through her chest, but she stayed rooted in place. On the monitor, the patient's heart rhythm began to waver. His oxygen levels dropped. A nurse placed a hand on his shoulder, whispering something soft. In the corner, a chaplain stood quietly, hands folded in prayer. Outside the trauma bay, through the glass window, Sarah saw them. The patient's wife and daughter had just arrived. The wife was older, silver-haired, clutching a tissue. The daughter was young, maybe 16, her face streaked with tears. They held each other, watching through the glass, silent and terrified. Sarah's heart broke. Then the monitor alarm screamed. "He's crashing," a nurse shouted. The patient's blood pressure plummeted. His pulse became erratic, thready. Dr. Gallagher grabbed the defibrillator paddles. "Charging to 200. Clear." The patient's body jolted. The monitor blipped, then flat-lined again. Again. "Charging. Clear." Another jolt. Still nothing. Sarah couldn't stand it anymore. She pushed forward, past the nurses, past the residents. She grabbed the ultrasound machine from the corner and wheeled it to the bedside. "What are you doing?" Gallagher demanded. Sarah didn't answer. She squirted gel on the ultrasound probe and pressed it against the patient's abdomen. The screen flickered to life. There it was. Black fluid filling the abdominal cavity. Free fluid. Blood. Liters of it. "Ruptured spleen," Sarah said firmly. "Massive hemoperitoneum. He's bleeding out internally. We need to open him up right now." Dr. Gallagher stared at the screen. For a moment, his confidence wavered. OR2 is open, Sarah continued, her voice steady. We can have him on the table in 3 minutes. It's his only chance. Gallagher looked at the monitor. The patient had no measurable blood pressure. His heart rhythm was barely a flicker. The older surgeon nodded once. Move. Now. They ran. Stretcher, monitors, 4 bags, everything rushed toward the operating room. Sarah ran alongside them, calling ahead for the surgical team. Within minutes, the patient was on the table. Dr. Gallagher made the incision. Blood poured out. Suction, he barked. Clamp that bleeder. Sarah assisted, hands steady, focused. They found the torn spleen, removed it, tied off vessels, stopped the bleeding. Slowly, the patient's heart rhythm strengthened. His pressure began to climb. The monitor beat steadily. He was alive. Hours later, in the quiet hallway outside recovery, Dr. Gallagher found Sarah. He looked tired, humbled. You saved his life, he said simply. Sarah nodded. She didn't need his validation. She'd already seen the patient's wife and daughter crying with relief, holding each other in gratitude. That was enough.